Dear friends, imagine this scenario. You or someone you love, perhaps around 75 years old or even older, looks down at their feet one day and notices something strange. A toenail doesn't look quite right. Maybe it's changed color or thickness. And then, over time, perhaps surprisingly quickly, it seems to be vanishing, just gone. It's a perplexing and frankly a little frightening change. What could possibly cause a toenail to disappear as we get older? Today, we're going to delve into this mystery of vanishing toenails after 75, and more importantly, talk about what dermatologists say are the crucial steps to take. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 10. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. So what is happening when a toenail seems to vanish? It's rarely one simple thing, but often a combination of factors. Let's gently explore the possibilities. One significant factor is simply the natural process of aging. Think about it. As our bodies get older, things slow down. This includes the processes needed to grow healthy nails. The supply of nutrients and blood flow to the extremities, like our toes, can decrease. The cells responsible for nail growth don't regenerate as quickly or efficiently. Over time, this can lead to nails becoming brittle, thinner, misshapen, and in some cases, they may detach or crumble away, giving the appearance of vanishing. It's a form of degeneration, much like other parts of our body experience. But sometimes, there's more to the story than just age. Underlying health conditions can play a major role, and this is where we need to pay close attention. Common culprits include fungal infections, often called onychomycosis, or simply nail fungus. This is incredibly common, especially as we age. The fungus can cause the nail to thicken, discolor, become brittle, and eventually separate from the nail bed. Other conditions like diabetes can severely impact circulation and nerve function in the feet. Poor blood flow means the nail doesn't receive the oxygen and nutrients it needs to stay healthy, making it prone to damage and loss. Similarly, peripheral vascular disease, which affects blood vessels in the limbs, can restrict blood flow to the feet and toes, leading to nail changes or loss. Certain skin conditions, or even repeated minor trauma to the nail, like from ill-fitting shoes, can also contribute over time. So if you notice a toenail starting to disappear or changing dramatically, what should you do? This is the emergency part of the solution, and it's absolutely critical. You need to see a doctor, specifically a dermatologist or a podiatrist, as soon as possible. Please don't wait. This isn't just a cosmetic issue. It could be a signal from your body about an underlying health problem that needs attention. When you see the doctor, they'll gently examine your feet and nails. They'll ask questions about your health history, your diet, your lifestyle, and when you first notice the change. They might take a small sample of the nail or the area underneath it to send to a lab. This is important because it can help them identify if a fungal infection is present or rule out other issues. They might also check your circulation or recommend blood tests if they suspect conditions like diabetes or vascular problems are involved. This detective work is necessary to get to the root cause. Once the doctor determines why the nail is vanishing, they can create a targeted treatment plan. If it's a fungal infection, they might prescribe oral antifungal medications, which can be very effective but need to be taken as directed, or sometimes topical treatments. If poor circulation is the issue, the focus will be on managing the underlying condition, perhaps through lifestyle changes, medication to improve blood flow, or managing conditions like diabetes or high blood pressure. For other causes, like skin conditions or trauma, the treatment will be tailored accordingly. The key is that treatment based on a proper diagnosis is essential for addressing the problem and preventing further issues. Beyond immediate medical attention, there are also daily steps you can take to support overall foot and nail health, which becomes even more important as we age. First, let's talk about diet and nutrition. Our nails are made of protein, keratin, and they need vitamins and minerals to grow strong. Ensuring you have enough protein in your diet is fundamental. Think lean meats, fish, eggs, beans, and nuts. Biotin, a B vitamin, is often associated with nail health, though its effects can vary. Getting enough vitamins A, C, D, E, and minerals, like zinc and iron, are also crucial for overall health, which in turn supports healthy nails. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins is one of the best things you can do for your whole body, including your feet. Then there's the daily care of your feet. Keep your feet clean and thoroughly dry, especially between the toes. Moisture can be a breeding ground for fungus. Trim your toenails straight across to help prevent ingrown nails, but be very careful not to cut them too short or damage the surrounding skin. Wear comfortable, well-fitting shoes that allow your toes room to move. Shoes that are too tight or narrow can put pressure on the nails and cause damage. Always wear clean socks, and consider socks made of moisture-wicking materials. Avoid walking barefoot in public places like locker rooms or pools where fungus can spread. Be gentle with your feet and protect them from injury. In summary, the mystery of vanishing toenails after 75 isn't usually an unsolvable puzzle, but rather a sign that warrants attention. While aging naturally affects our nails, the disappearance or significant change could be due to treatable conditions like fungal infections, diabetes, or vascular issues. The most important step is seeking prompt medical advice from a dermatologist or podiatrist to get an accurate diagnosis and targeted treatment. Coupled with good nutrition and consistent gentle foot care, you can take significant steps towards protecting your foot health. Your feet carry you through life, and paying attention to seemingly small changes like nail issues is an act of self-care that can prevent bigger problems down the road. Don't ignore these signals. Be observant, be proactive, and consult with healthcare professionals. Taking care of your feet means taking care of your ability to live actively and independently for years to come. It's about maintaining your well-being and enjoying a healthier, happier life. Pay attention to your feet. They are part of your story. Thank you for joining me today.